Hi, this is Dr. Boom. In this video, we'll be talking about clinical predictor calculators for pneumonia. Will I be admitted in the hospital, doc? This is the most common question a patient asks the doctor at the ER. Now, admission in the hospital is solely based on the doctor's decision, and this is influenced by the patient's presentation and how sick the patient is. But having said that, doctors have looked at some list of clinical predictor calculators to help them decide on which patient to keep in the hospital for further treatment. This will suggest which patients are at risk for dying or who will get sicker that they needed to stay in the hospital. The two most commonly used clinical predictor calculators that the doctors used are the Pneumonia Severity Index and Curve 65, and we will be looking at those clinical predictors in this video. This slide shows the Pneumonia Severity Index, or PORT score. It lists several factors with corresponding scores, such as age, sex, the medical history of the patient, if the patient is confused on presentation, the vital signs of the patient on presentation, as well as the results of the blood test and the chest x-ray if there is some fluid that will be seen. And as I said, each of this has a corresponding score, which will be added up to know the patient's risk. And for the score interpretation of the Pneumonia Severity Index, if the score is 90 and below, the patient is classified as low risk. And if the patient scores 91 and above, they are classified either as moderate or high. Now, the low-risk patient is managed either as outpatient, and for the risk class 3, they can be sent home or be briefly admitted in the hospital. However, if the patient presents with risk class 4 and 5, they are definitely needed to be admitted and in some cases needed to stay in the ICU. Now, the risk class defines the mortality risk of the patient, meaning that this corresponds to their risk of dying with pneumonia. Say risk class number 3, the risk of dying is only 0.9%, and those with score above 130 in the Pneumonia Severity Index has a risk of dying of 27%. And this score is the one that the doctors use to determine which pneumonia patients are sicker and needed to be treated in the hospital. Now, the other pneumonia risk calculator, which is easier to use, is the Curve 65. And it stands for confusion, uremia, which is seen in the blood test, meaning that the BUN should be greater than 19 milligrams per deciliter. If the patient is breathing fast, greater than 30 per minute, with systolic blood pressure less than 90, or diastolic blood pressure less than 60, with age equal to or greater than 65. And each of these, if positive, corresponds to 1 point each, with the highest total of 5. Now, to interpret the score of Curve 65, it defines the mortality risk, much like the Pneumonia Severity Index, with the higher the score, the greater the risk of dying. And the cutoff for the low risk would be 2, meaning that they can be treated at home or they can be treated very briefly in the hospital. If the curve score is 3 and above, they definitely needed to be in the hospital, and in some cases ICU admission. And as I said, the higher the score, the higher the risk of dying, with 4 or 5 having 27.8% risk of dying. Multiple studies have validated these clinical predictors, but again, These are just tools that the doctors use. In the end, it will be the doctor's clinical judgment to decide to keep the patient in the hospital or send the patient home for treatment. Thanks for watching. See you again in my next video, and God bless.